Today is Monday, the 23rd of November 2015. In this video I'm going to describe how we deal with the new diabetes cycle of care system within HealthOne. In order to activate this, you need to have the latest version of HealthOne, that is version 8. This has not yet been distributed but will be in the next few weeks. So there are three aspects really to the diabetes cycle of care. First of all, you have to find all your diabetes type 2 patients who have medical cards. B, you have to register all of these patients online, and C, you have to see the patients and record some clinical information. The first of these, that is the finding the patients, has been dealt with in another video, but I'll quickly go through this while I'm demonstrating the second part, which is registration. So first of all, I'll find my diabetes patients by clicking on Analysis, Database Analysis, this one here, which is the exact same as clicking on this button up here, and I go to my database analysis. I have an analysis preset called Cycle of Care, and in this analysis I am actually finding all my diabetes patients type 2 who have got recorded in their basic medical information in the item problem or the item medical history the coded content diabetes mellitus type 2. So this is a list in this small test database of the patients that I have recorded. So now I need to actually register these patients. I can register them from this analysis, or I can register them directly from the patient selector, or I can go into the file and register them while I am seeing them. The problem is that the PCRS don't allow us to register automatically, so we have to actually log on to the PCRS website to register. This means that you have to have a certificate on the computer to allow you to register. So very often this kind of registration either will have already been done or will be done by the receptionist in this kind of a manner. So if you have a list of your patients, you can right click on any of your patients found in the list and you can click on Cycle of Care Registration Diabetes. You can also do this directly from the patient selector by right clicking and going down and saying Cycle of Care Diabetes. You get precisely the same result. This will allow you or help you to register the patient online. So if I go back to my list of patients from my analysis, I can click on the first patient, right click on the first patient and go Cycle of Care Registration Diabetes. So this is the diabetes registration form in HealthOne. Now what HealthOne is going to do is it is going to record within the patient file the fact that you have registered the patient online. But HealthOne won't know you've registered the patient online unless you tell it. So there's two things you need to know, HealthOne needs to know. It needs to know that it has been registered online, the patient has been registered online, and the date that the patient was registered online, because many of the diabetes patients will have been pre-registered before they got this version of HealthOne. So you have some data here. HealthOne will help you with your online registration by clicking on this button, which I'll come back to. It'll take the patient's GMS number, which you can check by clicking this button immediately. You're required to enter the patient's ethnic group, and HealthOne here will give you some help with the diagnosis of diabetes. In this case, the HealthOne has found that this particular patient has got a diagnosis of diabetes in the item problem or medical history, and it has taken the date of the diagnosis from that problem, and therefore it has said that the patient can be registered. There's two information buttons here, a simple one here which tells you what the recommendations are as regards making a diagnosis of diabetes type 2, and in here with this button you can check your diabetes parameters directly from within the file. This patient, for example, had a blood sugar of 8.4 back to 11, and if you go back further you'll see various parameters. You can see he's never, as far as we can see, had his HbA1c done. In any case, you can make a decision as to register him or not. So in order to either register him online or to see if he has been registered online, I can click on this button. But this will only log in to the PCRS website if you have the required certificates on the local PC. So many of you won't be able to do this except at reception. HealthOne will, however, copy the patient's PCRS or GMS number in, and if the patient isn't registered online, you will get a screen to allow you to register him. In this case, the patient has been registered, and as you can see, the date of registration for this patient was the 14th of the 9th 2015. So I should now put in here 14th of the 9th 2015, so that I'm telling HealthOne what date this patient was registered. That's very important for your data feedback. So if I click OK here, this patient has now been successfully registered within HealthOne. What has actually happened in HealthOne is, if I double click on the file and actually open the file and show you and go back into his administrative section, you will see at the end of his administrative section we have added HealthOne has automatically added a new item called Cycle of Care Diabetes Mellitus Type 2 with the date of the online registration. This registration in HealthOne is critical if you're going to send good data back to the PCRS after a year. Otherwise HealthOne won't know what time frames it's talking about when returning data. In order to further help you with registration, we have set up a system whereby if you've previously registered the patient, you can select a number of patients either from the patient selector or from your analysis result and register them en masse. In this case, you right click on your group, you click on Cycle of Care Registration and Diabetes in this case. Now HealthOne is checking each of these files to see if the item Cycle of Care has been added to their files. If you know for a fact that these patients have already been registered and the date they were registered, you can put in the date here and click the three of them and they'll all be registered by clicking this button. If you're not sure, then you have to first check, and HealthOne once again, as previously, will help you with this. If you double click on either line, you go straight to the PCRS and you'll find out if this patient has been registered and the date they were registered. HealthOne will copy the medical card number into the PCRS dialogue. I repeat that this is not possible unless you have the correct certificates on the computer you're doing this on. So I could register all of these by clicking the register button, and it says you are about to register the 3 patients. This will confirm the online registration in HealthOne. Please make sure that they have been registered online, because if they're not registered online and you register them in HealthOne, then you'll be sending false data back to the PCRS and they won't accept it. So I click yes to that, and HealthOne will register all of those patients in one go. Now I can quite easily, within the patient selector, see a list. If I refresh this list here, you can see that I have registered these patients in the administrative item called Cycle of Care, and you can see that they're all here, so I can easily see a list of all my diabetes patients. I have actually flagged these patients as well, which I personally think is a great idea, but it's unrelated to the Cycle of Care per se. So the way to add these columns to your patient selector so that you can see what you're doing is to click on the Configure button down here, or right click anywhere on the selector and go down to Configure down at the bottom, and you can see here at the bottom of this the item Cycle of Care here has been ticked. That means that it's visible on the patient selector. So I can now see a list of my diabetes patients. So I have, with this video, demonstrated the registration in HealthOne of your diabetes patients. Many of you will already have registered your diabetes patients online, but HealthOne has to know that they're registered. So HealthOne has to be told, and we have demonstrated how you tell HealthOne. We also have shown you that HealthOne, while you're registering them on HealthOne, will also allow you or help you to register them online at the same time if you have the correct certificates installed on this computer. The final way to help you to register the patients online and in HealthOne is when you're seeing the patient. The patient arrives in the door, you're doing a new consultation on the patient by normal consultation, and you discover that he has diabetes, and you put diabetes into the problem list. What you do in that instance is you click on your Mediforms, and you, as if you're seeing the patient, and you type in diabetes, and there are 3 options here: diabetes cycle of care, diabetes review, and diabetes review 17. And we will be encouraging you to use this for all your diabetes patients who are in the cycle of care, that is, who have medical cards and have diabetes type 2 for the moment. So if you open this up and the patient has not been registered in HealthOne, then HealthOne will advise you so and would say, do you want to register the patient now? So if you haven't registered the patient online, you will again be able to register him by clicking on this button. If you have him registered online, then you have to know the date he has registered online, and therefore you need to put the date in here. Very often you won't know the date, so you'd be as well off to go in and check if he's been registered, to log in to your PCRS site like so, and you see this patient was registered on the 14th of the 9th 2015. So I would put that date in here, 14th of the 9th 2015. I would obviously it's a valid number, or he wouldn't have been allowed to be checked in. His diabetes has been entered in the BMI, as you can see here, and the date of the diagnosis has been taken from the basic medical information. So once I click OK, I have him registered in HealthOne, and I get the clinical Mediform that is the subject of the next video. Thank you very much. That's the end of this recording.